Filipino nurses are filling Maryland's major hospitals, east meeting west, to plug the hole left by the nagging nursing shortage. It is a critical labor development that at least 3 major Baltimore hospitals did not want to talk about.
Good afternoon.
Ivy Passis is one of 64 Filipino nurses working at Hopkins Bayview Medical Center. A public health nurse in Manila, she brought her family here last year after taking 4 qualifying exams. Hopkins paid for her visa, put the family up in this apartment complex, and generally helped them get settled. In exchange, Ivy agreed to work for Hopkins for 2 years.
Hopkins is investing an enormous amount of money in each of these people. On average, $7,000 to $10,000 a person.
That's about right.
The cost to bring Ivy here, 10 times her salary back in Manila.
I was paid for about $1,000 for a year, and yeah, $1,000 for a year, and as compared with what we have here, it's nothing.
They work very hard and make a great contribution to each of their individual units and to the hospital as a whole.
Many Filipino nurses send home a large portion of their paycheck, a benefit to their families and the struggling Philippine economy. In Baltimore, they are so valued, this church recently honored the Filipino nurses for their contributions. Why the Philippines in the first place? Well, nurses there are literally educated for export using American textbooks. And bringing them here has helped make a difference in Maryland hospitals. The vacancy rate for RNs, which once peaked at 15%, has just hit a 5-year low of 9%. Maryland's Nurses Association, led by Catherine Hall, welcomes the help.
The more nurses we have, the better care patients can receive.
If you show them how you care about the patients, I think that's the proof that you're a professional. You don't have to show them the papers.